Hello, everyone, and thank you for joining us today for a learning and growing webinar on depression among college students, causes, consequences, and solutions. This session is a part of our mental health awareness webinar series. Our presenter today is Jerrod Brown of Concordia University, St. Paul. My name is Sidra, and I'll be your moderator today for Hawks Learning. We will have a live Q&A session after the presentation, so please enter any questions you have into the Q&A module as we go, and we'll be sure to answer them at the end. I'll now hand it over to our presenter.
Can you see my screen okay?
Yes, we can.
All right. Well, good afternoon, everyone. I hope all of you are doing well. My name's Jerrod Brown. I'll be the presenter for today's topic. If you have any questions, again, type them in the chat box. If you think of questions after the fact, shoot me an email anytime. I get back to folks right away. I have tons and tons of resources on many of the topics that we're going to be covering today. We're going to be moving very quickly through today's slides. We have a lot to get through, but I want to give you guys a lot of different variables to think about when we examine the topic of depression. If you've never heard me present for Hawks Learning before, I'm a professor, trainer, researcher, and consultant. I've consulted on numerous cases where a client has had depression. I consult on clinical cases, forensic cases. My main areas of expertise relate to brain injuries and autism and trauma and a number of other different related topics. And currently, I am working on another master's degree in applied clinical nutrition. So if you hear me talk a little bit about like nutrition or heavy duty medical topics today, I'm just going to share what the literature says. I'm not giving any medical advice. These are just a few of my credentials and certifications. I have a lot of different certifications in topics related to wellness, digestive health issues, nutrition, and so on. And I'll try to weave some of this information into the talk today. And then these are my main areas of expertise where I do a lot of writing on. I go on a lot of podcasts. I do quite a bit of consultation work with different groups on a variety of topics. And depression is a topic that comes up frequently, and it seems like it's coming up more and more all the time since COVID-19. It was a problem before COVID, obviously, but just in my consultation work, it seems to be coming up even more frequently. So we're going to have a breakdown of what is depression in this first section, link it to college students, what's the research literature say. The next section will be about just screening, red flag indicators, some different things to kind of be on the lookout for. And then the last section will be about tips, strategies, solutions, interventions, things that you can do at your college and individual kinds of things you just want to be aware of as well. So when we think about depression as a whole, on the surface, it may seem like a pretty straightforward thing, but depression is actually a very complex topic, and I'll show you some slides here why it's really a complex thing to be aware of. So I have a few things underlined here. So we have loss of biological and behavioral flexibility. So basically, when we think of biological, hormones could be off, blood sugar dysregulation, gut health issues, sleep issues. Behavioral flexibility would be more related to executive function, metacognition. This I have underlined here, difficulty with adapting physiological and effective responses to meet situational demands. Basically, what this means in a nutshell, people with really severe depression oftentimes experience more physiological dysregulation. The affective component, mood instability, they have a hard time in some cases bouncing back. So resilience can be eroded. This has a lot to do with flexible behavior in a classroom, flexible thinking. Does the person have a lot of grit, stamina? Can they hang in there with things when things get tough? We'll talk about all these things in greater detail, including rumination. There's something called depressive rumination you want to be on the lookout for, where basically if someone is ruminating, it's just amplifying their already pre-existing kinds of negative thinking patterns. If they're having feelings of depression, rumination, catastrophication can amplify that. We'll talk about rumination too in a few minutes. Depression symptoms can vary from person to person. They don't always show up where you can see them quite easily. Most of the cases I've consulted on, it's pretty obvious, but people can have mild forms of depression, moderate or severe. And even if someone's dealing with apathy, which we'll talk about apathy really is a symptom of depression, but it might be someone that just kind of has more of a flat affect. Maybe they're a little more sluggish, a little more tired, but you're not seeing a lot of symptoms. But these are some of the classic symptoms to be on the lookout for depression. Again, this can present differently in people of different age groups. It could definitely present differently. So we need to take that into account. We have to be aware of cultural factors and considerations as well as gender kinds of situations as well. So when we think about the pathophysiological nature of depression, this is where it gets really, really complicated. This is where hopefully we all walk away wanting to learn more, because depression is one of the more complex kinds of symptoms or disorders that we're going to come into contact with. When we think about this, I have a lot of things underlined on this slide, but I have it broken down here for us visually. So let's just take a moment and go through each of these briefly. So negative cognitive style, what that could be, maybe you come in contact with a student who has a lot of black and white thinking, all or nothing thinking. They jump to the worst case scenario. They think the future is just very bleak. Unbalanced brain neurotransmitters. Any of you study like neuroscience, you're well aware of this. Neurotransmitters, hormones, dysfunction can play a role in this. Decline neuroplasticity, another huge topic you will want to be aware of when studying kind of all the moving parts that could be at play when we try to understand why someone may have depression. If you've heard me talk for Hawks before, you know I always talk about the HPA axis. This is the hypothalamic-pituitary-adrenal axis. This is our body's main stress response system. It's a hormone regulator. It plays a huge role in so many things in the human body. When this axis is not working at optimal levels, it has absolutely been linked to depression, and depression has been linked to more dysfunction in the HPA axis. Technically, when someone is dealing with chronic depression, they're probably also dealing with a state of chronic low-grade inflammation. Any of you interested in learning more about diseases, illnesses, mental health conditions? This is one of the most important topics of them all to learn about. Chronic low-grade inflammation is a driver of many, many diseases and illnesses, including depression. And earlier, multiple months ago, I did a training for Hawks Learning on the gut-brain axis. Why do you want to care about that? If someone is dealing with chronic depression, there's a pretty good chance that their gut is not working at optimal levels. So if someone is dealing with digestive health issues, that makes them more prone to depression, to anxiety, to sleep issues, all kinds of different things. Why is that the case? Because the gut is the hub of immunity. A large chunk of our serotonin and dopamine are produced in the gut, and there's many more things with that. We just don't have time to go deeper into that. This slide here is a master's degree program in and of itself. I will share my slides with any of you. Just shoot me an email. But these are some of the main variables you would want to be aware of if you truly want to get to the root cause of why people are dealing with maybe high levels of depression. So when we look at this here, lots of things to take into account. As I mentioned, inflammation. Now, inflammation is not a bad thing in of itself. We need it to live. But when we're talking about chronic low-grade inflammation, where someone is dealing with a high degree of inflammation in their body over a long period of time, that has been linked with all kinds of serious ramifications. There's a host of factors that can drive up inflammation in the body. What we eat, so someone eats a lot of fast food, people that smoke cigarettes, people that live a sedentary lifestyle, someone that's dealing with a high degree of stress and they have very poor coping skills. Inflammation can be driven up by environmental factors, pollution exposure, getting woken up at night frequently because of noise. So there's a multitude of factors that can drive the bus with inflammation. So again, the HPA axis, the takeaway point from this slide here is that if you're working with someone that is dealing with a high degree of depression over a long period of time, there's a pretty good chance that their HPA axis is not working properly. So again, this is a hormone regulator. This is really the hub of our neuroendocrine system. It communicates with our gut. It plays a huge role in just the way our hormones move around our body. And the end product of this axis is cortisol. Cortisol is a very good thing. Too much can be bad, and not enough can be bad. Too much cortisol, especially at night, because maybe we're dealing with a lot of stress, can absolutely impact our sleep. Not enough cortisol in the morning when we wake up can make us feel more sluggish during the day. There's all kinds of other things that cortisol does, but just know that it has a role in sleep and energy and all kinds of other things in the human body, including it can play a role in major depressive disorder if cortisol levels are not at optimal levels. So apathy, again, I mentioned this briefly before. Apathy is really, I would say it is a symptom of depression. It's more subtle, but if you are ever working with a student who has true apathy, it could look like lack of interest or a lack of enthusiasm. It can definitely present as lack of motivation. Now, I'm not saying every student that has lack of motivation is depressed, but it is a red flag indicator to be on the lookout for. In some cases, apathy can just look like that person is just very indifferent. They don't care either way. And apathy can absolutely interfere with day-to-day functioning because if someone presents apathetic in the classroom, that can impact performance. It can impact how that person's perceived by other people. If that student is working or trying to get a job and they're dealing with apathy, it might be very difficult to get through a job interview in a successful manner if someone's coming off as very apathetic. Rumination is a major topic to be aware of. Rumination is a problematic thinking style. You have depressive rumination where it can almost kind of have a snowball effect where it grows and grows the depression. You could have anger rumination where it could contribute to anger control problems in some cases. But high levels of rumination have been linked with problem-solving deficits. It can amplify anxiety and depression. It's basically a stress magnifier. It grows it, snowball effect. People with high levels of rumination oftentimes have other negative emotions. So if you notice a student that has a lot of negative emotions, negative emotionality, they're very moody, they're highly anxious, they seem very apathetic. Could rumination be a factor to take into account? The answer is yes, in some cases. What are some basic tips and strategies you want to be aware of when we talk about reducing rumination? Journaling has been shown to be helpful. Exercise can be very, very helpful. There's a whole line of thought switching techniques that people can try. Thought switching techniques relate to like listening to music, watching a movie, doing a crossword puzzle, knitting, getting your mind off of the rumination and focusing on something else. Irritability could be a symptom of depression. Irritability really is a fascinating topic that I talk about a lot when I do trainings for different groups. Irritability co-occurs with so many different mental health disorders. Or irritability in and of itself could just be the person's just irritable about something. But this could be a red flag indicator that that person is dealing with depression. And if you can target irritability and help that person learn skills to reduce feelings of irritability, that's a very practical strategy that can be very helpful in helping that individual not deal with such high levels of depression. So if we have any mental health therapists in the crowd or school counselors, understanding irritability and apathy, I think are very important topics to be aware of when treating college students with depression. Without a doubt, depression can adversely impact brain functioning. So if you hear me talk about cognitive impairments today, just know I'm talking about brain-based impairments, executive function impairments, metacognitive deficits. There's a multitude of factors that we can do to help improve brain functioning. Self-compassion is a huge thing that can help with this. We'll talk about that in the tips, strategies, and solutions. The very nature of laughing has been linked with improvements in cognitive health. Getting out in nature is a great practical strategy. So we'll talk about these more in a little bit. But when we think about what are the various factors that can impact our cognition or brain health, all kinds of things, including depression, which is the focus of today. But look at all these other things that can have an impact on brain health, including lower educational levels. So if a student is in college, they're going through college, they're learning, they graduate. That is technically a protective factor, which can play a huge role in improving our cognitive health. If you have students that are dealing with diabetes, particularly untreated, unmanaged blood sugar levels, without a doubt, that can have an impact on brain health. Obesity technically is being in a chronic state of low-grade inflammation. That's been linked with more cognitive health. If you have students that smoke cigarettes or live a sedentary lifestyle, the list goes on, but these are just a few variables to be aware of that can adversely impact the brain health of the students you work with. So adaptive functioning basically relates to how people take care of themselves in day-to-day life. It relates to independent living skills, social responsibility, money management, how people use time effectively. This has a lot to do with social skills. The takeaway point from this is people with high levels of depression oftentimes have adaptive functioning limitations. So what might this look like practically with a student? So the student might be dealing with major depressive disorder. They show up to class. They're not there on time. They're unprepared. Maybe their hygiene is poor. These are all adaptive functioning skills that might be adversely impacted by their depression. And just know too, oftentimes depression is not the only thing someone is dealing with. Depression can co-occur with multiple other disorders, illnesses, physical health complaints. So just know, especially when we're talking about major depressive disorder, a lot of times the person will also be dealing with some level of medical health issues or other psychiatric issues. There's a host of factors that can contribute to this, but just know that depression oftentimes is not the only thing someone is dealing with. And metabolic syndrome, this is a huge issue nationwide and around the world. It's an issue among college students as well. So if someone is dealing with metabolic syndrome or metabolic dysfunction, this could be obesity, cholesterol issues, cardiovascular disease risk factors, blood sugar dysregulation issues, anxiety, and depression oftentimes co-occur when someone is dealing with metabolic dysfunction. And I just wanted to show this here too, in case any of you are interested in taking your knowledge deeper as it pertains to major mental illness in general, not just major depressive disorder, but maybe you are wanting to learn more about bipolar disorder or schizophrenia or other kinds of serious and persistent mental health disorders. When you are working with an individual who is dealing with any kind of major mental illness, and if that major mental illness is unaddressed, untreated, unmanaged, they may be more likely to be dealing with these variables. Again, every person is different, but if you look at the general research, people with major mental health concerns compared to folks that don't have these disorders may be more likely to be dealing with any of these kind of variables. When we start thinking about depression among college students, unfortunately, there are numerous studies that point to the fact that it really is a major issue. Some of these studies were published before COVID. COVID-19 amplified this issue without a doubt. So just know this, some of the statistics I'm showing you likely are probably even more increased during the era of COVID and beyond. So looking at some studies, it's really all over the map in terms of statistics, but just know that a sizable percentage of college students are dealing with some level of depression, some more than others. And again, a lot of factors to take into account. But if you take a look at this slide, these are some of the factors and triggers or contributors to depression among college students. Again, this can vary from campus to campus, location to location. But if a college student has a tendency to compare themselves to their peers frequently, that could be a potential trigger. Ruling out drug or alcohol problems, including tobacco use, excessive sugar consumption, and even energy drink consumption should be considered as part of a holistic kind of understanding and intervention process. Genetic factors may play a role in some cases. Fear of disappointing parents or loved ones is a huge triggering event for some individuals. If that college student is dealing with a recent breakup, or maybe they're having some conflict with some of their close friends or roommates, huge factor to take into account. Unfortunately, too, we need to be aware that trauma is a real thing we have to be aware of. So if that student has experienced some sort of traumatic event, that can absolutely be a triggering event. And just being aware of any other kind of adjustment difficulties the student's dealing with, or any other high levels of stress. These are just some of the potential triggers for depression among college students. If we look at mental health concerns in general, not just depression, but anxiety, bipolar disorder, schizoaffective disorder, schizophrenia, and a number of other mental health concerns, these are some other variables to take into account specific to college students. So if you are working on a college campus and you are trying to really develop some sort of program to address student mental health, adjustment difficulties definitely should be considered. Information overload is a variable that maybe we don't think about enough. If that student is bombarded with social media, they maybe have a social media addiction, they're on their gadgets all the time. This can impact their sleep. This can impact their brain health. Last year, I did a training for Hawks Learning on food insecurity. You can check that out, I believe, on YouTube. Food insecurity is a real problem among college students nationwide. I believe some of the statistics point to the fact that maybe as many as 40% of undergraduate students may be dealing with some level of food insecurity. Again, this isn't specific to any one campus. These are more national statistics. Stigma is a huge topic. Naming it, verbalizing it, helping students know they're not alone. Mental health concerns are real. They're not the only person feeling that, helping them reduce stigma, and working hand in hand with your college's counseling center or finding other community resources. These are some variables you might want to consider. And just know that academic stress, anxiety, and depression are some of the biggest concerns among college students. And a lot of times these go hand in hand. Depression, anxiety can be experienced individually or together, And academic stress is a huge driver for this for many college students. And if we look at this through a stress lens as well, I think all of this can play a role in understanding why mental health concerns are elevated, depression's elevated. Again, just being aware of all the stressors that a lot of college students do face. So being aware of exams, their workload outside of school. Are they competing? Are they constantly comparing themselves to other people? The biological factors, this could be sleep issues, what they eat, hormonal dysregulation, blood sugar dysregulation. If you have a student that skips breakfast in the morning, that could lead to lower blood sugar levels, which is a biological factor to take into account. And what about financial burden, poverty, homelessness, food insecurity? All kinds of stressors we need to be aware of. Stress, sleep issues, anxiety, and depression are threats to academic performance. Today, we're covering this. A couple months ago, I did a sleep training for Hawks Learning. I believe you can find online as well if you're interested, but just know that these oftentimes co-occur. Academic procrastination is a real issue as well for many students. A big driver for that could be untreated depression. Being aware, being on the lookout for all of these variables when you're working with students that seem to procrastinate. Be curious, take a step back, dig deeper. Maybe the student is procrastinating because they are dealing with some serious physical or emotional problems where they don't know how to ask for help. They're scared to ask for help. And if you could get them referred to the school counselor, that might play a huge role in combating academic procrastination. And why are we talking about this topic? Huge, huge topic, obviously, but another big variable to consider is that when students are dealing with a high degree of anxiety, stress, depression, sleep issues, and if that college lacks the understanding, the awareness, and doesn't have a lot of supports and services for students who are dealing with these issues, that student may be much more likely to drop a class and in some cases just quit school altogether. So I'm going to park the brakes there for a moment, open it up to any thoughts or questions before we jump in to this next section. If we don't have any, we'll stop at the end and I'll answer a bunch of questions there as well. So again, from a screening lens, a red flag indicator lens, a lot of variables to take into account that we need to be aware of that can cause psychological distress among college students. And if that college student is dealing with a high level of psychological distress, they're going to be much more likely to be prone to experiencing anxiety, depression, sleep issues. These are just some of the factors to take into account. Age of the student, self-esteem dynamics. Is that student dealing with a high degree of shame, guilt? Do they sleep well? Are they dealing with untreated sleep apnea? Are they dealing with insomnia? Where do they live? Who do they live with? These are factors to take into account. Is that student using alcohol, drugs? Do they seem to have an issue with excessive screen time exposure? These are some of the main variables you'd want to take into account. So if we take a step back, this is not necessarily just to college students, but it would really apply to anyone that's dealing with a mental health issue. This is a long list of variables to take into account. Again, I'll share my email at the end, and you can shoot me an email and I'll send you my slides. But if you really want to understand mental health issues, these would be some of the variables you might want to take into account that could be driving the bus in some cases. We need to be aware of marginalization, oppression, racism, discrimination, being excluded are huge drivers for poor mental health. Early adverse childhood experiences. These are childhood traumatic events occurring to the individual before the age of 18. And the more traumatic experiences that person has had before they become an adult, there's a greater likelihood that they're going to be dealing with more mental health, social problems, physical health issues. These are just some of the variables you'd want to consider. This is not an all-encompassing lens, but it is a good list, I think, to just be aware from that holistic lens. Any of you interested in neuroscience, you'll probably appreciate this, but knowing that we need to really look through a neuroscience lens as well when studying depression. I give a lot of talks on neuroscience topics. This slide here comes out of the neurocounseling literature. I really like it, and I think it can be applied to really any setting. But take a look at this. If we look at this through a neurological and a biological lens, look at all of the different variables that could play into someone having more neurological dysregulation, brain-based impairments, and this can absolutely relate to depression. Prenatal factors. We won't get too much in the weeds here, but know that some college students may have had some problematic prenatal experiences. Disease and fever early on in life. What are they currently diagnosed with? Diet, nutrition, exercise status, sleep status, all play a role into this. How do they manage stress? Is the student dealing with any kind of stress-related illnesses or diseases? Chronic pain is a huge issue. Chronic pain issues are a huge driver for depression and anxiety. Maybe it's migraine headaches, maybe it's joint pain, maybe it's gut health issues, maybe it's arthritis, maybe it's from a traumatic brain injury. Chronic pain's a big, big issue as well. Being aware that for some students, they may not reach out for help. So you want to be aware of what kind of barriers might be in place that prevent that student from asking their professor for help or some sort of other college professional that I need help. I'm dealing with depression. I feel anxious. Is there someone I can talk to? These are some of the barriers talked about in the research literature. Confidentiality concerns. Someone doesn't want other people knowing their business. Stigma. Obviously, if we can start naming this, giving more trainings on this, normalizing this, that many people are dealing with mental health challenges. If we can reduce that stigma, that can hopefully open the door to more and more students reaching out for help. Some students don't seek help because of just time constraints. If that student has a full course load, they're working full time, they're busy. So that oftentimes takes precedence. Financial restrictions are a barrier if that student maybe doesn't have health insurance, or there's just transportation barriers, these kind of things. The more we can reduce these factors, the more likely that student might reach out for help. Again, I'm not giving any nutritional advice here, but poor dietary practices are very, very common among college students. I've given several talks now to Hawks Learning on various aspects of poor dietary practices. And the research as a whole shows college students are much more likely to eat fast food, consume a lot of sugar. These are variables that can have a huge impact on that student's health and well-being. Basically, poor dietary practices over the long haul are a threat to our health. Under the umbrella of poor dietary practices are going to be the Western diet way of eating. So if someone eats this way, which most Americans do, unfortunately, this would relate to higher levels of fast food consumption, gas station food, foods that are highly processed, foods that are just loaded with preservatives and salts and sugars, high levels of carbs, lots of red meat, probably very little fruits and vegetables. This way of eating over a long period of time has been linked with more obesity, chronic inflammation. Remember, chronic inflammation is a driver of many diseases and illnesses, including depression. Why are we seeing a huge increase in allergies in our country in the past several decades. I'm not saying it's just the Western diet, but this is a major culprit we want to be aware of. Why are we seeing an explosion of type 2 diabetes cases over the past several decades? The way we eat plays a huge role, not the only factor. Autoimmune issues. This way of eating has been linked with more depression, more metabolic issues, and more neuropsychiatric concerns. So the takeaway point here is if people eat this way day in and day out, it really is a threat to health and wellness. Excessive fast food consumption is very, very common among college students, and it has been linked with more depression. Dysbiosis, if you were part of the training I did on the gut-brain axis, you learned about this. Gut dysbiosis basically means that our gut is not working at optimal levels. When we have gut dysbiosis, when there's dysregulation in the gut-brain axis, that can be a triggering event for more mental health problems. So again, if we have any counselors, therapists in the crowd, one of your frontline interventions, in my opinion, would be to help that student understand the importance of optimizing their gut. Again, maybe it might be outside the scope of your practice, so referring that student to a healthcare provider who has expertise in this. But if you want to improve mental health, improve the gut. That is a very important starting point, in my opinion. And again, why should we care about fast food consumption, junk food consumption? And I'm not talking about if someone eats this way here and there, but if someone's eating this way all the time, day in and day out, year after year, it has been linked with more behavioral problems, more hyperactivity concerns. So a lot of times these can look like ADHD in some cases in the classroom, more depression, more energy issues, fatigue, motivational concerns. So again, what we eat plays a huge role. Breaking this down further, if we look at this through a nutrition lens, again, why are we spending a little bit more time on nutrition? Because poor dietary practices, according to the research, are very common among college students. This is a factor we need to consider. Take a look at this. People that eat a lot of processed foods, sugar sweetened desserts, sugar sweetened beverages, refined grains, fried foods, lots of processed meats, high fat dairy products, according to the research literature, may place that person at greater risk for depression. If someone eats a lot of processed pastries and muffins and donuts and croissants, and every morning they get up and they run to the gas station, get their coffee, get their donut. Again, I'm not saying don't do that, but if you're doing that every single day after day, some research points to the fact it could increase risk of depression for some people. The same with sugar sweetened beverages. I gave a talk for Hawks Learning specifically on this topic, and we know from the research that excessive consumption of sugar sweetened beverages is very common among college students, and it can increase the risk of anxiety and depression. While on this spectrum, high caffeine energy drink intake may be a risk factor for depression. There are some studies that show that high caffeine energy intake may co-occur or accelerate smoking, alcohol consumption, violent behavior in some cases, depression, and even suicidal thinking. What do we do about this information? Maybe it would be helpful to offer an education class to your faculty, to your students on some of these topics, because I don't think a lot of people are aware of the research on this. Now, if somebody had these drinks once in a while, is it going to contribute to these things? Probably not, but if they're consuming a high degree of these kinds of products day in and day out, it may increase the risk for some of these things. Taking a look at this list, again, this is one study of many, but excessive consumption of energy drinks, numerous studies have been published on this. I've given a lot of podcasts on some of these topics. So if you want some links to some of these, just shoot me an email as well. I'll be more than happy to share that with you. But excessive consumption of energy drinks can impact our physical health, our emotional health, our behavioral health. It can cause students to become more restless, increase anxiety and depression. The list goes on and on and on. Food insecurity, again, very common among college students. This issue has gone up since COVID. Students who fall under this umbrella are likely to deal with higher levels of depression compared to students who are not food insecure. So if you're not familiar with food insecurity, what might this be? Basically, food insecurity would mean the student doesn't have enough means, enough money to purchase high quality food. It could mean they're meal skipping. It could mean that they just don't have hardly any money at all and they're going to bed every night very hungry. You could have people that are food insecure where they have plenty of food, but they only are eating low quality processed foods because they don't have enough money to buy high quality food. Food insecurity has been linked with all kinds of medical issues, including a significant increase in mental health problems. If any of you are working in drug and alcohol kinds of programs, the research shows that the majority of people in drug and alcohol treatment programs would fall under the umbrella of food insecurity. If we have any criminal justice professionals here, a very high percentage of people coming out of prison fall under this umbrella of food insecurity. And some research shows that food insecurity may be a risk factor for violent behavior, suicide, child abuse, domestic violence, to name a few. Helping students move more is a really good way to combat depression. Unfortunately, sedentary behaviors are quite common among college students. A high percentage of college students are also going to be dealing with some level of depression caused by sleep deprivation. Sleep deprivation can cause all kinds of issues, including motivational issues, anxiety problems. Addressing sleep issues among college students is another strategy, a tip that can help improve the overall mental health of your students. Unfortunately, smartphone addiction, excessive internet addiction, even just excessive exposure to any kind of screens, particularly in the evening time right before bed, is a threat to our health. This is what some of the research literature in general says about smartphone addiction. So being aware of this, I give a lot of talks on excessive screen time exposure, and people are surprised to learn how much of a threat that truly is to our emotional and psychological health, including it can really drive the bus with higher levels of depression, anxiety, and stress. We're not going to spend a lot of time on this, but I wanted to just plant the seed here. This is a huge topic you got to be aware of. Theory of mind. Theory of mind relates to perspective taking, how that student interacts with other people. A lot of times it can look like empathy. If somebody is dealing with theory of mind deficits, it could look like they lack perspective taking. It could look like they're coming off as cold, callous, aloof. Theory of mind deficits oftentimes co-occur with higher levels of depression, loneliness, and anxiety. A lot of studies have been published on theory of mind over the last several decades. Alexithymia is a huge topic that I suspect a lot of you have probably never heard of. As many as half of people with serious mental health challenges may be dealing with what's called alexithymia. It's called emotional blindness. It relates to people having a hard time naming emotions, labeling emotions. It can look a lot like apathy. Alexithymia is not a disorder, but it co-occurs with so many things. You as professionals, you've probably dealt with this. We've all dealt with this on some level. Professional burnout can cause us to have alexithymia. Alexithymia can be accelerated by depression, anxiety, high levels of stress. If someone is dealing with true alexithymia, they have a hard time getting their emotions out. Their emotions bottle up in their body. It comes out sideways, sometimes as anger problems, panic attacks, chest pain, headaches. Alexithymia is a threat to our health. It's been associated with all kinds of different illnesses, disorders, and diseases. And again, optimizing the gut is a primary intervention. If the gut is off, it's been linked with more depression, anxiety, all kinds of things. Gut health issues are a real problem. And just know, according to the research, if you're working with someone with a serious mental health issue, that should alert you to the fact that that person probably is dealing with some digestive health issues on some level. Before we move into our last section with tips, strategies, solutions, I will stop for a moment, see if anyone's got any questions, concerns, anything you want to push back on that I said you disagree with. Love to hear from you.
We have a question. College math classes require our students to spend a lot of screen time working on homework problems. What suggestions do you have to help these students balance screen time when they are required to spend so much time on the computer?
The best strategy I can recommend is, if appropriate, I know it's very difficult with college student schedules. The research shows that our brains and bodies should be off the screen when the sun goes down. Why is that the case? Because as the sun goes down, it's outside, our brains start producing more melatonin, which helps us sleep. If we're looking at the screen late into the evening, right before bed, that is interfering with our melatonin secretion, which can now jack up the bus with cortisol. And we don't want too much cortisol at night, or we're not going to get good sleep. So, if possible, educating students about trying to get off the screen when the sun goes down. In all practicality, I know that might not be possible, so start small. Is it possible to encourage the student to maybe even just a half hour before bedtime to get off the screen? Another practical strategy would be to get some different kind of, I don't know what they're called, but you put it on your computer and it kind of minimizes the blue light that comes out. That can be helpful. If anyone knows some of those products, I'd love to, if you could type it in the chat box. But those would be a couple things to be aware of. And I guess another practical strategy too would be, I think every college campus would do quite well providing a training, an in-service kind of workshop to faculty, to staff, to their students about excessive screen time exposure. Because if we don't know about the threats it can have to our health, how can we make practical changes in our life that can help us reduce our screen time exposure? Any other thoughts, questions I can answer before we go into tips, strategies, solutions?
Yep, we have one other question. How much should I know about my students?
Yeah, that's a tough balance. Again, you're not depending on what role you play. I mean, you're probably not sitting down having a therapy session with them. But if you're noticing these red flag indicators, these patterns that I'm pointing out here, obviously talk to your supervisors, follow policy. But is it appropriate to pull your student aside after class for a minute, have a check-in, ask how you doing? I'm noticing I'm seeing this. Would it be okay if I could maybe refer you to our school counselor to talk, or just open that bridge somehow, just to point out things where you're not getting in there and diagnosing and telling the student, I think you have bipolar disorder, I think you have major depressive disorder. But again, if you're seeing some red flag indicators, gentle nudging, gentle inquiring, making sure the student's okay, and consulting with your supervisors too, maybe even consulting with your school counselor, or if appropriate, having your school counselors come to class, give some one-on-one talks about depression, anxiety, sleep issues to your students and faculty. Just general education, empowering that student with knowledge may open the door to that student saying, you know what, I just heard that. I think I do need to go talk to someone. Very, very good question. Thank you for that. So I'm a major fan of just always trying to be kind and nice and patient and curious. And I think those approaches, and I'm never perfect, but I strive to be like that. they really fall under a strengths-based approach. And if you can have a strengths-based approach with your students in whatever you do, you're focusing on students' strengths and their qualities and their attributes and their abilities and their hobbies. They're likely to do better in whatever they do if you use these kinds of approaches. I'm a major fan of positive psychology research, positive psychological interventions. Basically, what these are is promoting resilience, having gratitude, being thankful, cultivating a classroom of joy and happiness and encouragement, and really focusing on enhancing student self-efficacy, being teaching about self-compassion. I have some slides on that I'll show you in a couple minutes. But if you believe the research, if you use strengths-based approaches and positive psychological approaches, it can play a role in enhancing emotional health and well-being when maybe that wasn't your primary target. When we focus on emotional well-being, having hopeful thinking, being mindful of the language we use, if we can promote resilience in our staff and our faculty and our students, we're much more likely to bounce back from tough stuff. We're much more likely to be adaptable and flexible rather than rigid. If you can promote self-efficacy in yourself and your students, your belief in your own abilities goes up and you're much more likely to achieve your goals. Students, faculty, or anyone that utilizes these approaches, and if you can enhance your well-being, look at all the wonderful benefits that can happen as a result of enhanced well-being. It can lower our blood pressure. We might be able to improve our immune system, which we might be able to fight off infections much more effectively. Telomere length, if anyone wants me to go into that, just let me know at the end, but I would recommend studying the adverse childhood experiences, complex developmental trauma, even epigenetics research related to this. You want to live longer, enhance your well-being. If you want to have better brain capacity, better memory, better problem solving, utilizing some of these approaches are supported. There's a multitude of things we can do to help people reduce stress and guard against stress. Gratitude. Gratitude I've found to be very helpful. How do we cultivate gratitude? Being enthusiastic, being more optimistic, focusing on fostering trust, fostering well-being. It really is a protective factor. Providing students with education about gratitude or giving a lecture on gratitude, there's some really cool research findings out there about gratitude and brain science and just how it can just change our thinking and how it can play a huge role in improving our health and well-being. All of these interventions I'm talking about do not have to be done face to face. So if you're a college campus and maybe you don't have a lot of resources on campus, digital health, telehealth, remote-based services, and even telephone-based interventions are supported in the literature. So getting students connected to different providers, not just on campus, but maybe that student is really, really busy and they don't have a lot of time to connect. Telehealth might be a great way to reduce some barriers. Helping students sleep better, offering classes on this, becoming educated is so important for health and well-being. Same with faculty. The more you can learn about sleep, sleep is number one to health. In my opinion, that's the foundation to health. Everything's built on our sleep, in my opinion. If anyone disagrees, let's chat. I'd love to hear your perspective. These are some things, practical strategies that can be used to help reduce sleep issues. We all know exercise is important. I'm not asking you to go out and develop an exercise prescription or exercise plan for your students, but getting students to move more and reducing sedentary behaviors is a great way to reduce depression. Counselors, therapists, people who are trained in this within the academic arena, mindfulness meditation has been shown to play a role in improving academic performance. and improving student mental health. Meditation, mindfulness, lots of research on this. Practicing mindfulness, maybe it's offering a mindfulness class on campus. Maybe you offer a mindful yoga class. Might be worth looking into. This is just some of the research on the benefits of mindfulness. Reduces pain. Remember, pain's a huge driver for depression. Reduces anxiety, reduces stress. It's a great way to regulate our HPA axis. Remember our hormone regulator. Yoga, again, I'm not asking you to do yoga in your classroom, but maybe if you have a trained yoga instructor, you're offering some yoga classes on campus. Yoga has been linked with reductions in depression and enhancement in emotional well-being. Getting students outside in nature, maybe you do a field trip. Learning about green space exposure literature is fascinating. This is just a few of the studies that talk about the benefits of getting people out in nature more. It plays a huge role in reducing stress, anxiety, and depression. So green space exposure, just getting out in nature more around trees and wilderness can play a huge role in this. So remember I mentioned self-compassion before, very practical strategy. If you teach psychology classes, counseling classes, highly recommend offering at least an hour-long presentation on this to your students because self-compassion has been linked with so many positive outcomes, including pain reduction. It can play a role in treating eating disorders. It can play a role in helping people exercise more, reduce smoking, improvements in self-regulation. It plays a huge role in reducing depression and stress. If people have a fear of failure, self-compassion interventions have been shown to reduce that fear. It can play a role in enhancing happiness and greater self-worth. There's virtually no side effects to practicing self-compassion. Promoting resilience, the greater resilience we have, the greater ability that we can bounce back when something tough really happens. We all need resilience. Life is tough. The higher levels of resilience we have, the greater ability we can be more adaptable and flexible. Staying curious, helping students become more curious really is a very positive thing for our emotional and cognitive health. These are just some of the benefits found in the research literature about promoting curiosity. If we can always have a mindset of wanting to learn, wanting to grow, that might be a great way to combat depression, anxiety, and sleep issues as well. Maybe you're a writing instructor. Infusing some positive writing activities into the work you do has been shown to also enhance well-being. Counselors, therapists, whatever role you play, these are some quick strategies to be aware of if you're working with students who have a high degree of negative emotionality. Getting people to volunteer is another great way to combat depression, according to the research. People who volunteer and give back are much less likely to feel high levels of depression, some research has found. In helping people belong, including staff, faculty, and students, has been shown to reduce depression, anxiety, sleep issues, all kinds of things. So if someone doesn't feel like they belong to a group and they feel excluded or isolated, that can absolutely drive the bus with depression. Again, not given any kind of medical advice, nutritional advice, but the research shows, again, remember the Western diet, threat to health and well-being. The Mediterranean diet is one of the best studied diets out there. And if people eat the Mediterranean diet, it has been linked to reductions in mental health. And as we wrap up today, again, I will share my slides with you and I'll share my email again. Wellness. If we can promote student wellness, we're probably helping students reduce depression. We're probably helping students increase motivation. They're going to be less likely to drop out of school. They're going to be more likely to achieve their goals. This is a slide that I'll have in the slides. If you just shoot me an email, I'll send you my slides. But if you want to understand the various dimensions of wellness, This slide is probably one of the best articles and studies out there that I could find that really talk about the different dimensions that go into helping us as human beings have greater levels of health and wellness and well-being. So thank you, everyone. I know we covered a lot of ground in a short period of time. Again, this is my email address. Shoot me an email if you have questions, thoughts, concerns. If you want a copy of my slides or you're looking for any of my podcasts and some of these topics, just let me know. And I'll park the brakes now, open it up to any questions people may have.
We have a bunch. So, do you recommend online classes?
Well, I guess it really depends. I love online myself, but I've done on ground too. So it really depends. I'd love to hear more. Are you saying to the student or faculty or both? There's pros and cons. Obviously, online really accelerated during the era of COVID-19, but there are plenty of colleges around the country who've offered online programs and degrees for a very long time. So it really would depend on kind of the context.
This was in regards to the reducing blue light prior to bedtime.
It
So
it, it depends because I teach a lot of online classes now, and there are some students that are doing their work late into the evening. So I don't know if that, it's so tough to know. It really would be individualized to the student. So you'd have to dig deeper because a lot of students could be transportation issues or could be working full-time, family factors. So it really depends. I hate to not give you a straight answer on that.
that's okay. I appreciate it.
Yeah.
In California, there's a big push for online sources for classes, zero cost textbooks. So that will increase screen time. Do you have any suggestions about that?
Yeah, the strategies I mentioned before would be, I think, where I would start maybe offering an in-service lecture, just educating people about, again, screen time exposure, what to know, how much, when to get off of it, being aware of, again, how much exposure should you have into the evening, how that can impact sleep and melatonin production, taking breaks from it, getting some screens to put on your screen to kind of minimize the blue light exposure. And I know there's some glasses people can buy out there. I don't know the names of them, but you can wear them too, and that can help reduce some of that light exposure that might play a role in helping too.
Okay, great. Thank you.
Yeah.
Most people think that depression is a mental illness. Would you consider it to be one?
I would say it is a severe neuropsychiatric and medical condition issue. So it's medical, neuro, and psychiatric, and there's biological factors there. But know that depression can be a symptom of something else. It can be a full-blown disorder as well. So depression can be a symptom of so many things. Like if someone got a really bad grade on an exam, that situational factor could cause feelings of depression. It's likely not to probably cause major depression. Maybe it could in some cases, but clients with major depressive disorder who actually get the diagnosis, they have to meet a diagnostic criteria. So you want to look at the DSM for that. And that's likely driven by many of those factors I showed you earlier, where there's neurological factors, biological, environmental, sometimes genetic, and even sometimes prenatal factors, which we didn't get into that today. If you want to understand prenatal factors, understand the first 1,000 days of life research literature. That would be a really good literature base I would recommend.
Thank you so much.
You bet.
Could you provide an example of positive writing assignments?
Gratitude journaling. Maybe you have some sort of writing assignment where every day you start your class, where students write down one thing they're thankful for, or two things they're thankful for, or maybe they talk about one person that they're thankful for who's made a difference in their life. So you can link it to anything, making it positive, linking it to something happening currently or in the past or even in the future. Writing about something that you'd like to see positive happen to you or your friends or your family or your children. What are your dreams? What are your goals? If you have people write about that, you get them in a mindset of thinking about hopeful possibilities. That can help reduce inflammation. It can help our brains work better, and it can probably play a role in reducing symptoms of stress, anxiety, and depression as well.
Thank you so much.
Of course.
Well, that looks like all the time we have for questions today. Thank you, Jerrod, for this impactful webinar, and thank you all for attending today. We will be emailing you a link to view the recording of this webinar once it's available. To check out our other upcoming mental health centered webinars and curated resources for education, please visit our website, which I'm going to go ahead and link in the chat now for easy access. Also, if you or any of your fellow instructors are interested in presenting for our Learning and Growing webinar series, please submit your proposals to the Learning and Growing website, which I'm also going to link in the chat right now for easy access. These free webinars are brought to you by Hawks Learning, an innovative educational courseware company. To learn more about our mastery-based course materials and how Hawks can enhance learning outcomes for you and your students, please visit hawkslearning.com, and I hope everyone has a great rest of your day. Thank you all for attending.
Thank you, everyone.